Hey guys, Tony Maritato here. In this YouTube comment, I want to answer two elements that I think are really important and affect a lot of people. First, for context, this person says they're 9 weeks post-op, which is still pretty new to the recovery process. But this person is primarily concerned that they're still having clunking and pain on the lateral aspect of the knee, and they're still having a lot of pain underneath the kneecap when they're going downstairs. Let's break that up into two components. When they're walking, is it normal to still have, quote, clunking when I walk along and buckling, and I still have a significant amount of pain behind the patella? So the clunking you feel on the outside of the knee, that is most likely due to the joint between the fibular head and the top of the tibia. The fibula runs along the outside of the lower leg. The tibia is the shin bone. The fibula comes up and kind of joins at the top. A lot of patients will have a clunking sensation when they're walking, and it's actually the joint where the fibula butts up against the tibia. Technically, it's not the knee joint. It's a separate joint. It was not involved in the total knee replacement surgery, but it tends to be arthritic and it tends to have some problems. I want you to do a little bit of research based on your YouTube post. You are researching things for yourself. I've got other videos on the channel talking about pain on the lateral aspect of the knee, but the joint between the fibula and the tibia is probably where you're having your problem. In regards to pain under the patella, so you mentioned in the comment that you couldn't even do straight leg raise laying on your back. You couldn't do side leg raise. You have a hard time going upstairs, but it's impossible for you to go downstairs step over step. My concern would be to investigate what's going on with the patella itself. Now, we have had cases where the patella had a fracture. It was undiagnosed until they went and did deeper investigation. There's likely a button or a cap that's covering the bottom of the patella. So in theory, you would not have pain, but if there is a patella fracture or injury to the bone, you would then develop pain in the way that you describe. I would talk to your surgeon about it. I would let the surgeon know that you were doing your own research, which of course I'm encouraging you to do, and that you were looking at possible causes for the pain under the patella. Now, if they did not cover the bottom side of your patella, then you might just have osteoarthritis pain under the patella. You might have tendinopathy or patellar tendonitis. Either of those would cause pain similar to what you're describing. It's not unusual that somebody will develop this kind of pain and impairment when they're recovering from knee replacement because they're usually, truthfully, they're doing too much too quickly. If you had a severely arthritic knee that justified a knee replacement prior to surgery, you weren't able to do a lot. But then 24 hours after surgery, you're doing a ton. And so we've got a couple of things to look at. The pain under the kneecap could be patellar tendonitis or patellar tendinopathy. It could also potentially be a problem with the bone of the patella itself. It could be, if they didn't put a button or a cover under the patella, it could be arthritis associated with that. So we kind of have three things to investigate. The pain at the outside of the knee, clunking when you're walking, that could be associated with arthritic changes at the joint between the fibula and the tibia. Go ahead and do some work on that. Sometimes if you change the position of your foot, toe in, toe out, toe straight, you might be able to control when it's clunking, if it's clunking. And you didn't mention in the comment, I don't know what kind of flexion and extension you have right now, but if you don't have full extension, that too might be contributing to some of the clunking of the fibular head. So as you improve extension, that clunking might go away.